Hello, my name is Shaka Allen, and I'm going to do an informative speech on high blood pressure, and this is my audience. According to the American Heart Association, nearly half of American adults have high blood pressure, many of whom are unaware that they have it. Therefore, this condition has also been known as the silent killer. Most of the time, there are no obvious symptoms for this condition. And when left untreated, this condition causes damage to the circulatory system and can lead to heart disease, stroke, and many other complications. So one may ask, what exactly is high blood pressure? What are the symptoms, and how can one treat it if diagnosed? High blood pressure is also known as hypertension. It is defined as the force of blood flow against the walls of the arteries that is consistently too high. Just like air in a tire or water in a hose, blood fills your arteries to a certain point. Too much air pressure can damage a tire, or too much water pushing through a water hose can damage the hose, just as it would your arteries. To measure your blood pressure, your doctor or specialist would use an inflatable arm cuff and put it around your arm and use a pressure measuring gauge. A blood pressure reading is given in millimeters of mercury. A blood pressure reading given in millimeters of mercury has two numbers. The first number, which is your upper number, is your systolic pressure, and this is measured when your heart beats. The second measurement, or your lower number, which is your diastolic reading, measures the pressure in your arteries between heartbeats. Normal blood pressure is 180/20. A systolic pressure ranging between 130 to 138 millimeters of mercury, or 80 to 89, is considered hypertensive. Most people with high blood pressure have no signs and symptoms, even if their blood pressure is dangerously too high. Some people have been known to experience things such as headaches, nosebleeds, and dizziness, but these signs and symptoms are not specific and usually do not occur until blood pressure is extremely too high. Now let us look at the risks and complications that are also associated with high blood pressure. High blood pressure has many risk factors. They include age, race, obesity, family history, stress, and lack of physical activity, just to name a few. The longer high blood pressure goes uncontrolled or untreated, it leads to complications such as heart attack, stroke, aneurysms, narrowing or closing of the blood vessels to the kidneys, thickening or hardening of the blood vessels to the eyes. If left uncontrolled, these conditions can cause death. Now let us look at high blood pressure and how it can be controlled and treated. Changing your lifestyle can go a long way toward treating high blood pressure. High blood pressure can be controlled and managed along with diet and exercise and complying with medications prescribed by your doctor. A healthy lifestyle can not only help you manage high blood pressure, it can also help you prevent it. The category of medication that your doctor prescribes usually depends on your blood pressure measurement and any other medical conditions that one may have. In conclusion today, I have explained to you what high blood pressure is, the dangers of it, and how it can be treated. High blood pressure isn't a problem that can be treated and ignored. High blood pressure is a condition that needs to be managed for the rest of your life. Sticking to lifestyle changes can be difficult, especially if you don't see or feel any symptoms of high blood pressure. It's never too early to make lifestyle changes, such as eating healthy and becoming more physically active. These are the primary lines of defense for high blood pressure and how to prevent these complications. The sources that I use for my article are heart.org, mayoclinic.org, cdc.gov, and a book called Hypertension by Balaj Bekins. Thank you.